So, welcome today. We are diving into the newly released ISN Global Kidney Health Atlas Map, your dynamic go to resource for global kidney health data from the ISN GKHA. After months of hard work, it's finally here and it's set to change how the kidney health community access and utilize this vital information. We are excited to explore the impact of our guest today.
Yeah, so welcome, Aminu. So, my first question goes to you.
Thank you.
What inspired the creation of this interactive map? I mean, and how will it change the way global kidney health data is accessed?
Yeah, no, thank you very much. This is very important. Global Kidney Health Atlas, as known by many in the nephrology community, is an initiative by the ISN to collect information on the organization structures for kidney care delivery around all countries as well as region. It started a while ago, since 2017, and so far we have heard 3 iterations, 2017, 2019, and 2023, documenting information on the way kidney care is organized, delivered, funded across all countries of the world and regions. We know that we have a lot of information out there in terms of prevalence, incidence of kidney disease, particularly kidney failure in terms of registry. But what has been lacking generally is the data about processes of care, availability of dialysis facilities, availability of structures for early prevention and management of CKD around the world. So that's the gap the GKHA, set in to fill. And over the years we have done it. We have published, report every year. It's already on the ISN website. We have done a number of publications. And all this, you could say, is all, academic, essentially, academic communication targeted to our membership, targeted to other professionals working in the field of nephrology. But we realize there is so much need to really translate the data into practice, which is called knowledge transfer, or knowledge implementation. And the only way of doing this to get information across to people that matters, who are the policy makers, the decision makers, right? So if you document in a country, let's say, Nigeria, there's X number of dialysis facilities. So who is there to improve the number will be the policy makers, people that have access to the resources, the budget. So the only way of getting this information is to make it more publicly available in a language that is easy to understand, that is also pretty interactive. So that's the reason why the ISN GKHE interactive map was developed. It's the first among several organizations around the world.
Yes, I truly agree with you.
Yeah.
In fact, most of the countries don't have the registries. So that is the point where we lack the data from those countries. That is also one limiting factor. And yes, we all appreciate the ISN initiative of the fellowship programs, where the inter-country fellows they are exchanged and then they are trained for a good number of months, good period of time, and then they can go back to their own country and they can serve in a better way. So that is also one initiative which is from the ISN. I truly appreciate that
Exactly. Yeah.
initiative.
And it does complements to what is on registry, which is largely information on disease, burden of CKD, kidney failure, and so on. But this is more into structures available to deliver care. Yeah.
So my next question is to you.
Okay.
How does the map enhance the visibility and influence global kidney health policies?
Yeah, but easy, because in this day of advanced or communication age, right? People like everything, online. So we make it really simple, easy to use, navigate. People can go in, catch information about their countries, compare their country with other sister country within a particular region, or even at a global level. So all the information there is presented as different levels, country level, regional, as well as global. and also by economic ranking, so that people can play around with it, understand, and hopefully use the information to advocate for better kidney care for their
Yes,
countries and people.
yeah, we saw this. We saw this, the how the countries' work can be compared, and how you can know that where you are
Exactly.
standing
Yeah.
on the platform, the whole worldly platform.
That's right. Yeah.
Yeah. So
And it's just the beginning, and hopefully I will advance. There may be ability also to develop a tool that people could compare information within a country, particularly big countries like China, India, is imperative to have such a tool where we can compare information within a country as well, and that's the goal for the future. Yeah.
the last question to you.
Okay.
So, what do you hope users will gain from its visualization and indicators?
Yeah, so now having information, easy access to information about the state of kidney care across the spectrum of kidney disease, from acute kidney injury to chronic kidney disease, provision of kidney replacement therapy, dialysis, transplantation, and even availability to deliver care in what is called conservative kidney management. Yeah, that
The
is
preventive.
available. Exactly. So people will know, like, okay, my country, doesn't have, facilities or structures for conservative kidney management, but sister country or a neighboring country within my region has. Then they can use that information and go and contact, those professionals of the neighboring country and support them with information on how to set up structures for conservative kidney management and some with prevention in all aspects of CKD as well.
We all could see the data. We could compare the data also, like the where is the lower middle income countries and where is
Exactly.
the higher
Yeah, and
income
that-
countries.
yeah.
The gaps and everything. It was beautifully
That's right,
portrayed
exactly.
in
And
your slides, and
yeah.
yes, we all are thankful to it.
Yeah.
And the data. And
Oh, thank you very much. Yeah, and beyond the interactive tool, also people know there are embedded there also presentations in form of PowerPoint slides that are freely available for use by every region. They're
Thank you.
There and publication as well. So yeah, thank you.
Thank you.
So I would just want to add an Arabic phrase, which is
Okay.
"درهم وقاية خير من قنطار علاج." It means prevention is better than cure. So that's why I'd love,
should add
yeah,
that.
I love the work that you do, and I do really admire it. And now I'm moving to Somkanya. I had
Thank you.
the pleasure of doing the visual abstract for one of your
Oh.
studies. Yeah, that's why I was super excited for the interview. So this question is for you. How can this map empower young nephrologists to address global kidney health challenges?
Okay, thank you for that. So I think the career path for the young nephrologist may involve just, mainly the three aspects. So it could be either the service as the nephrologist, the research, or the educational, maybe teaching program. So for the service, I think Aminu has mentioned a lot that this interactive map can pinpoint the disparity gaps, so they would know the challenges within the country or the region, so they can see the gaps and they can come up with the evidence-based solution, including research or initiative. And also they can, for the research, they can it foster the global collaboration with our shared data, so they can do the further analysis with our data. And also, it can connect the nephrologists across border because they have the shared data sets. Yeah, and finally, because our website is so very understandable, easily accessed, so they can use it as the educational tool for the training, so that they can update it and empower them to advocate for a better kidney care in the future.
Yeah, it's good to hear that you have a nephrologist friendly website.
Thank
We don't
you.
see that so much. So how can it foster greater engagement, especially from people living with kidney disease? Now we're talking about the patients.
Okay, this is very important, and I would say that this is like the concept behind our website, because we really want to reach out to non-MD, like non-physicians audience. So we try to make this interactive website very simple, comprehensible, and accessible. So, people living with kidney disease, I would say both the patient themselves or the caregivers, they often seek to better understand their conditions and the treatments. So this interactive map will help this, make it easier for them to understand the burden of the disease in the region, and then to know availability of the treatments or the dialysis service within the area. So they know the gaps, they know the challenges within the area, and they will raise their awareness of the condition and the problems within the area, and then we'll also advocate them for better treatment and better care.
That's amazing that we have now an amazing tool that can help patients and their caregivers to understand more about their disease and to find solutions as well, because sometimes we get the solutions from the patients themselves. They would have like lots of initiatives and they come with great ideas of how can they make their life easier, because sometimes we have just this tunnel vision like of research and medications and trying to understand more the disease, but maybe we lack that an understanding of the patient perspective as
Right.
well.
And if you explore our website, you'll see that beyond just the technical term, we have the non-technical description, we have the data visualization, we have the instruction of everything. So yeah, it's very accessible and understandable for everyone.
Yeah, that's good to hear. Thank you.
Okay.
So I would like to add to this because in most of the lower middle income countries, the first contact physician is not the specialist.
Okay. So the second question is, how can it foster greater engagement, especially from patients or people living with kidney disease?
This is very important point. Well, thank you for that. So we really want to make our website or our interactive map to reach non-MD, non-physician audience. So we try to make it simple, comprehensible, and accessible. We include like all the non-technical description. We provide the key insights and key findings, so it make them easier to understand. And for people living with kidney disease, including both the patient themselves and the caregivers, they often seek to better understand their conditions and the situation within the region. So I think our map would help them to make them easier to understand what the challenges they have, the situation they have within their region or the country. So I think it raises their awareness of their condition and may enable them to advocate for better care and better treatment within the area.
Yeah, that's really amazing work, because it's not only the patients but their caregivers as well. They feel always isolated when it comes to medical terminology and talking about medications and more investigations. But this way they will feel more engaged, and they have a wider vision than the tunnel vision some of us may have sometimes for the view of their diseases. So they may come with some solutions as well that may help us. Yeah,
Right.
that's great.
And with this way of communication, I think not only the patients or the caregivers, I mean, like for the stakeholders, it's not non-MD, for the healthcare organization, national organization, or the industry as well, so they would know what they would need to focus on, to fix the gaps.
Yeah, I think it's the most important to include the other stakeholders, as you mentioned. Like I met few of the people who are working in public health sector, scientists but non-physicians, and they were asking about the sessions that can help them the most, because they are non-nephrologists. So we guided them to the global policy sessions, and they were amazed about it. We got really a good feedback about it. So thank you very much for the great work.
You're welcome. Thank you.
So it's basically a total 360-degree coverage. Patients, caregivers, the physicians, and everyone, us also. Thank you so much for this interactive session.
Thank you very
Yeah,
much for the
and-
opportunity to share this, and we remain very appreciative of the support of the larger ISN community, membership, leadership, ISN staff for putting all hands together to make this initiative a success.
We are into this together.
And this map is just the beginning, so we really value your feedbacks. Please visit our website and share your thoughts. We can improve this with your inputs. And we do hope that this map will be the initiative tool to help us bridge the gaps in disparity to really go to the policy change and really improve our global kidney health.
So the beginning is already amazing. So thank you, Professor Aminu and Somkanya, for sharing your insights on the transformative potential of the ISN GKH interactive map. And to the audience, thank you for joining us. Explore the map and join us in advancing kidney health worldwide. See you next time.
Thank you.
So thank you. Bye-bye. Bye.